Tarik, thank you so much for joining us. A million questions. Let's maybe start with whether the virus was man-made. Is there any evidence of that, and how would that change everything?
Good morning to you. All the evidence that we have so far point out that this is coronavirus of the family of coronaviruses circulating in the animal world, primarily in a population of bats. What we don't know so far is what was the intermediate species that allowed the virus to cross from bats to humans, because in most of previous cases we knew that there was intermediate species, as direct contact between bat population and humans is very limited. So there are some investigations ongoing into trying to find that. And again, so far, the evidence and genetic sequence that has been analyzed by a number of scientists point out that this is the virus that is being circulating in the animal world.
Tarik, give us a sense, first of all, of what will happen today if the U.S. blames China for a mishandling of the crisis. Is there evidence of that? How does the WHO try and investigate and get to the bottom of exactly what happened?
Well, it's very difficult to speculate, and we should all wait and watch the proceedings of the World Health Assembly. And the World Health Assembly, for the first time, will be virtual, and it will be only 2 days. Normally, these meetings are much longer and discuss a variety of public health issues. This time, we will only have one topic being discussed. It's COVID-19 and some procedural matters. So it's only 2 days assembly, and member states will have a possibility to address the World Health Assembly and make their points. So from our side, we are always reviewing how WHO is functioning, and we have after action reviews. But right now, really, we are looking forward to hear from the world leaders what they have to say.
Tarik, when you look at some of the things that each country is doing individual in reopening, who's getting it right? Does the WHO have a template on how we kind of feel our way through reopening economy? Do people have to wear masks? Why don't we have a uniform way of, how you reopen an economy while keeping people safe?
Well, first of all, the situation is not the same in each country. So every country it has its own specificities. It's in a different state, maybe in a different stage of the outbreak. WHO has issued a set of guidance on how we should ease restrictions if a country decides to get out of these restrictive measures that have been put in place in many places. So one of them is to really try to make sure that we know where the virus is. Second is to have a health systems that are strong enough and prepared enough to quickly identify people who are sick, test them, treat them, isolate them, and look for contacts. And also to make sure that we have enough of capacity if there is an increased number of newly infected people. We also have to look into vulnerable population, like elderly population in facilities that were providing care for those elderly, and we have seen that there was a lot of transmission in those places. We have to look into workplace, how we can ensure that protective measures are being put in place in a workplace. And also, we really need to explain to population why we are changing the restriction measures and what is to be expected, because a full engagement of the population in any given place is crucial that measures may actually be successful.
What do we know about antibody testing, Tarik? Has the WHO identified a couple of them that are valuable but also that work? Because at the moment there are questions about which ones work, which ones don't, and you have very different results depending on the one you take.
Well, so far the WHO is recommending PCR testing, so that's to understand who has the virus. When it comes to antibody tests, there are several of them being developed. From our position, each one of these tests should be really independently verified and evaluated before it gets recommendation. But it is important that we get to have antibody tests, because that will give us the clear information of how many people have actually been carrying the virus in the past. There are some studies that are being carried on, and for example, some preliminary studies have shown that really a small percentage of population has antibodies, and that basically says that still majority of people are susceptible to be infected, and this is something that we have to take into account when we do to this opening of activities and economy that we just talked about.